Hey there, it's Dr. Jason Lichten of Central Ohio Plastic Surgery. What I want to do is talk to you today about implants, implant styles, implant sizes, and how we pick the right size breast implant for a patient who's undergoing breast augmentation. A lot of people will talk about breast implants in the sense that they know the volume of the breast implant that they have, and they know the volume they think they want, and they know what their bra size is and what bra size they think they want. I can tell you in my office, I do employ more of a biodimensional approach, which means I think measurements of the chest, measurements of the breast base width are the most important things for helping figure out what size implant's right for you. So I'm less concerned about the specific volume of the implant. What looks good on one person's chest versus another may be very different depending on the size, the dimension, the width of the chest, the width of the breast for which we want to put the implant in. Similarly, bra size. Every woman out there knows you can go to one store, find a bra that fits exactly perfectly, although that's not necessarily the easiest thing, but you may find the bra that fits exactly perfectly and has whatever size. It's a 34C. You may go to the next store and find a bra that feels exactly the same as that other bra, and it may be labeled something completely different. It may be a 32D, it may be a 36B, it may be a 36D. It all depends on what the bra manufacturer labels their bras. So bra size we talk about because it's a common language to sort of understand what your goals are for breast augmentation, but most of the time it's about finding something that fits your base width, finding the projection that matters to you, and then picking the implant from there. So I'll show you what I mean when we talk about implants and implant size. So the difference between a 300cc implant, 300cc implant, and 300cc implant can be very different depending on the width of the implant and the projection. Even though I tell you all three of those have the same volume, you can see this is a more projecting implant, this is flatter, and the width of those implants are going to be completely different. So the most important thing is you match the width to the width of the implant to the width of your chest that you're of the patient, and get the right size implant that matches your goals. So if we take this and we look at Allergan's implants, for example, Allergan has 5 different projections of implants. And you can see here the difference between a low, low plus, moderate, full, and extra full profile implant. And all of these have basically the same width. My low profile implant's a little bit wider, but otherwise they all have the same width, and therefore would fit on the same woman's chest. So most of the time, most women end up between the moderate or full size implant or the extra full implant. And the way I sort of describe this is 95% of my patients end up in here, about 5% or so have the I want as big as possible of an implant. And the way I'll describe this as, you know, some people say, well, is this a C, a D, a double D? Again, it depends on the bra manufacturer. But the way I'll really describe it as people's reaction to you is, oh, I didn't even realize you had breast implants. I thought maybe you did. I knew you did. And that's, again, not why you do augmentation, but that helps you sort of gauge what size implant, what projection is going to be right for you. The moderate implant is that restoring the volume that you had before childbirth, before aging, before weight loss. Full is a little bit more. The extra full is, you know, a fuller implant. Now we can adjust this and go wider on the width of an implant, but I think an implant that fits your chest looks more natural. If it spills out into the armpit because the implant is too wide, that tends to look more unnatural, even than it going to a higher profile implant. People say, well, you know, what's the difference between silicone implants, and you've heard information about textured breast implants and textured shapes, and I have examples of those here. We don't use a lot of textured shaped implants anymore in this practice, sometimes in reconstruction, but for the most part, the shape and the look of an implant that you're going to get in the body when you're standing upright is similar to what the shaped implant will be. The difference is that a shaped implant, if it turns, will look more unnatural versus this implant, no matter what angle, is going to keep that same natural shape to the breast. But there are different implant companies, and the difference between a textured implant or shaped implant and a smooth round implant, those first ones I showed you, is that these that have a shape to them, these are the three main implant companies, Mentor, Sientra, and Allergan's shaped textured implants. Now, Allergan's textured shaped implant was taken off the market in 2019 due to fears and concerns related to BIA-ALCL, which is still an extremely rare phenomenon. But this implant is not available anymore. But again, most of the patients will do smooth, but you can see somewhat from this. Again, this is more by feel, but you can feel a more aggressive texturing or roughness of this compared to the other two implants. And that's what's thought to be related to ALCL. But again, for the most part, most patients are doing smooth round implants. Now, the difference between a saline implant, a silicone implant, has a lot to do with feel and shape. But if you look here, and again, this is more something you're going to see when you come into the office for an examination and to a consultation, you can sort of feel the difference. This will feel more natural. And you see as it sits more natural. The saline implant here has a little bit more round look to it. Well, what do we have over here? This is a different saline implant. This is called the Ideal implant. It's a different implant company. They only make saline implants, but the difference between this saline and this saline is that this one has it has 2 lumens, so we can fill from the front and the back, as well as interior shells that help give it more of a structure and shape, that much more like a silicone implant than the round saline implant. Difference in these has to do a lot with the difference in cost and longevity on how long those implants are going to last. But for someone who comes in and says, I don't want to have a silicone implant, even with feel being the most natural feel, because of concerns over things they've heard or things they've read, I can tell you I don't have those concerns. I think silicone implants are safe, and the majority of my patients actually do get silicone implants. Because when we talk about silicone implants, if you look at the silicone implants, the history, back in the 1980s, there's a lot of silicone implants used. In 1992, they were taken off the market due to concerns about safety, and then put back on the market in 2006. There's a huge difference between the silicone implants of today versus the implants from the 80s. If you look at a silicone implant today, it's thicker, it holds its shape, it has a little more structure to it. If we compare it to the 1980s silicone implant, it's a much thinner wall. The silicone inside is much less structure to it, less cohesive. And you can see how this is just not going to last as long as what we have here. So this is the workhorse. This is the one we do the majority of my patients because of feel, because of shape, because of look. It looks more natural. So, like we talked about in terms of projections, that's what we're going to find in the consultation. You're going to come in, we're going to do exam, we're going to do some measurements based on some other factors, not just the width, but the thickness of the skin, the stretch of the skin, how much breast tissue cover you have. But that's the primary way that we look at implants, the difference between different type of implants. I hope this helps. If there's questions, go to my website, centralohioplasticsurgery.com or ohioplastic.com. There's lots of information there, patient before and afters, contact form to reach me, to ask any questions you may have, or call the office and set things up. We'll set up a consultation. You come in and feel these, we'll do some measurements and figure out the right size implant for you.